Hi, I'm Rachel Garrod. I am a respiratory physiotherapist, PhD qualified, and my PhD is in helping people with lung disease exercise. And what I want to talk to you about today is something called pulmonary rehabilitation. I want to talk to you about how we can work together to help improve lung disease. Now, I spent 20 years in academia and in clinical teaching, and in all those years I was working with people with lung disease, predominantly chronic obstructive pulmonary disease, COPD, but also patients with asthma, cystic fibrosis, fibrotic lungs, so lots of different respiratory conditions. Now I know that if you have a lung disease and you're breathless, I know physiotherapy is not what you think of first of all. You think you need your nebs, which you do, or your inhalers, which you do. But I want to show you today and talk to you today about some of the really powerful and helpful treatments that physiotherapists can offer. Okay. This slide comes from the National Institute of Clinical Excellence, and that's the body that decides the treatments that are going to go into the National Health Service in the UK. And what this is telling us is that pulmonary rehabilitation is an individualised, tailored, multidisciplinary programme of care should be delivered and made available to all appropriate people, including those recently hospitalised for an acute exacerbation or chest infection or an attack of your illness. Now this is an addition to the original NICE COPD guidelines, and this is really important because when we started pulmonary rehabilitation, we thought that patients had to be stable for a long time before we could begin the programme of treatment with them. But the more recent studies have shown pretty conclusively that actually intervening at the stage when a patient has just had an attack or an exacerbation, okay, they need to be a little bit better, a couple of weeks after they're out of hospital or so, but that actually has really positive benefits for the patient. So they themselves feel a lot less breathless a lot more quickly. They get a lot of good leg strength because being in hospital and being ill attacks your muscles. And this is the absolute important fact. And by having pulmonary rehabilitation after a hospitalisation or an attack, you are less likely to have another hospitalisation, or at least you reduce the amount of future ones. So it's an absolute essential treatment that needs to be delivered after somebody has had an illness as well as in the stable phase. I told you I live in Spain and we're very lucky to have gorgeous weather. So this is one of my patients exercising with me on the paseo. And what I wanted to show you this picture is because she's performing just lovely pursed lip breathing. And again, that's one of the things that we're going to do is help you learn breathing techniques that will enable you to actually perform more exercise, more activity, and be less breathless when you're out and about. So what is pulmonary rehabilitation? It's a program of exercise, education, and psychosocial help for people with breathing problems. Now, those three components work together, and we generally deliver pulmonary rehab in groups. Patients come to us at the exercise lab, in the gyms, or in community centres, or even just at home. And the exercise component is essential because what we're doing there is we're working on improving muscle strength. Now, the stronger your muscles are, the more efficiently they use oxygen. So if you are breathless, and when you're walking up hills or you're walking upstairs, you're getting out of breath, well, the stronger your muscles are, the more efficiently they will work, and so they'll use oxygen more efficiently, so you'll be less breathless. The other part to the exercise component is that the fitter you are, the less your heart will have to work for a given amount of exercise. So if you're going upstairs again and you normally get very breathless after 2 or 3 steps, well, if you're fitter, you'll be able to do 4 or 5 steps before you get breathless, or 6 or 7. It depends on your initial levels of fitness. Now, we used to think that people with COPD or breathing problems were unable to exercise enough to actually get fitter, but we know that's wrong now. We know that's not true. You can exercise. It's small, it's gradual, and it's incremental. And that's the point. It has to be progressive. So the programs are not just a one-off session. It's in England, in the UK, we do 6 to 8 weeks programs. In Belgium and other countries, they do 3-month programs. So it takes time for the muscles to get stronger. Now, there's another component. I said that there was exercise, but there's also education. We teach you about your lung disease. We teach you about what's going on in your lungs, what your medicines are for. We teach you when to go to the doctor, how you can best control your breathing. We give you breathing techniques and tips that help you manage better. So that's exercise and education, and then the psychosocial. Well, what we're talking about really with psychosocial is managing some of the anxiety that comes with breathlessness. And it's perfectly understandable, and everybody would be the same. When you get out of breath, it is very frightening and it can be very scary. So one of the aspects that we do is we teach you how to cope with the breathlessness, how to cope with the anxiety, and we teach you relaxation skills, maybe some meditation techniques, all very simple techniques that are embedded in the program of pulmonary rehabilitation. So it's a really, really important, comprehensive, holistic treatment for people who are breathless when they're walking around. Now, there is a lot of evidence, massive of evidence, grade A, strong, good randomized controlled trials to show that pulmonary rehabilitation is effective. I was involved with a lot of those trials, and actually if you look my name up, Rachel Garrod, Garrod, you will see that a number of studies that have been published in pulmonary rehabilitation were led and performed by me. I do know what I'm talking about with regards to pulmonary rehabilitation. So what are the benefits? What could you expect to see if you undertook a program of pulmonary rehabilitation? The first thing is that you would be able to walk further. Your exercise tolerance will improve. You will be less breathless. You'll have less anxiety and you'll have more energy. Now, these things we know and have been proven in randomized controlled trials about pulmonary rehabilitation. Improves exercise tolerance, improves breathlessness, it reduces anxiety, increases energy, and it will increase your muscle strength. Those are really important things which result in an improvement in quality of life. And that is what we all want, is to have a decent quality of life. So I just want you to be aware that there is a treatment that will help and has evidence to support it. Now, I provide pulmonary rehabilitation face-to-face. I live in Spain, in Marbella, and I provide pulmonary rehabilitation on an individual basis or in group sessions. But I can also provide pulmonary rehabilitation by Skype, because at the end of the day, it's you who's got to do the work. My job is to help you learn what intensity to do the work at and how to breathe whilst you're exercising and what sort of exercises to do. So we can do it by Skype as well. So please get in touch. The next slide will show my contact details. And let's see if we can work together to help improve your lung disease. Oh yes, and did you spot Columbus, my lovely little doggy coming in through the door there? Oh, well, he took no notice, did he? Okay, I did say I'd give you my contact details, and I will do in the very next slide. But I just wanted to slip this photo in of Pat and Alf, because this sums up absolutely what pulmonary rehabilitation is all about. Pat and Alf enjoyed their waltzes, their lunchtime dancing, and the problem was that Pat was getting more and more breathless and had to sit out a number of the dances, which was obviously affecting the quality of life and the things that they did together that they enjoyed. So Pat undertook an 8-week program with us at King's College Hospital. And this is the picture that they sent us at the end of the program. And she said that she was now able to dance and move with less breathlessness than ever before. And she felt great. And they sent us this photo, which was absolutely lovely. And at the end of the day, that's what pulmonary rehab is about. Because there's nothing worse than not being able to do what you want to do because you're too breathless. So please do get in touch if any of this has resonated with you. We can have a chat and see if there's anything I can do to help you. You can email me on rachelgarrod1@gmail.com. You can call me on +34 652 281 122. And I've got a Facebook page, Better Breathing for Life. Be lovely to speak to you, lovely to have a chat, and thank you so much for listening to me. Bye.